Experts stress care while handling the dead. The Health Ministry has issued guidelines for the disposal of bodies, while noting that an increased risk of infection from a dead body is unlikely. For infectious diseases, the World Health Organization prescribes various biosafety levels with bodies, medical gear, and disposable. For bodies of dead COVID-19 patients, the WHO is mandating BSL 3. By BSL 3, ideally, bodies must be packed intact in leak-proof plastic and cremated. The ministry advises families not to hug, wash, or kiss the body. Embalming and unzipping the packed body must be avoided. WHO and AIIMS advise cremation unless a family insists on burial for religious reasons. During burial, family is advised to not touch the body. The ministry has issued guidelines for health workers, such as hand hygiene, use of personal protective equipment like water-resistant apron, gloves, masks, eyewear, and disinfection of the bag housing the body and linen. The lungs of a dead COVID-19 patient, if not handled correctly during an autopsy, can be infectious. To prevent contact of doctors and mortuary workers with the deceased's body fluids, an autopsy must be avoided unless required. If autopsy is a must, one has to wear protective gear and then disinfect the entire autopsy room, including instruments, with sodium hypochlorite. In a mortuary, the body should be preserved at 4 to 6 degrees centigrade, if not cremated immediately.
Dead body management performed by the team of doctors and healthcare workers from the department was a huge challenge which was successfully accepted and delivered during the peak of the pandemic in order to ensure that the two major aspects of dead body management are not compromised in any way, and thereby ensuring a respectful disposal of human body, keeping in mind all the religious customs and ceremonies that need to be performed as the last rites of a human, and thereby also ensuring that the virus was kept at bay. Dead body management basically involves three steps. Number one, sanitization of the body surface and packing of the body in a leak-proof body bag. Number two, transportation of the body to the mortuary for documentation and short storage. And last, number three, transportation of the body to the crematorium and performance of the last rites in a religious manner. On receiving the information from the COVID hospital wards about death of any patient, the team of workers immediately report to the respective ward and starts the dead body management process. It starts with shielding of the body using the examination screen so that the nearby patients are not disturbed. Thereafter, there is complete sanitization of the body surface by using a spray of 1% hypochlorite solution. Then there is plugging of the natural orifices, mainly the mouth and nostrils, to avoid any secretions coming out of the body. And then the body is shifted to the dead body management room for proper packaging of body in leak-proof body bags. The body of the deceased, along with its belongings, is shifted to the dead body management room on a stretcher On receiving the body in the room, the body is then shifted to a dead body bag which is made of plastic, and it ensures that the secretions of the body do not reach the outer surface of the bag because of the non-porous nature of the bag, and also there is a transparent portion over the body bag which helps in identification of the deceased by its relatives without the need of opening the body bag. After the body is packed, the workers look for any flaws or tears in the bag, and after confirmation of that, the body is then shifted to the ambulance with the help of a stretcher. The ambulance then takes the body to the nearly situated mortuary complex where the body can be preserved for a short span of time till the necessary documentation with respect to the dead body management is done, and the family members in the meanwhile are ready to carry out the respectful cremation of the deceased, keeping in mind their religious customs. Hence, this short stay of body in the mortuary provides ample time to the relatives of the deceased to make necessary arrangements for the cremation purpose. However, in case of any unexpected delay, the body can be stored in the freezer at 4 to 6 degrees Celsius till the crematorium is available and the deceased relatives are ready to carry out the cremation. The body is then shifted to the crematorium via an ambulance. The relatives can visualize the deceased through the transparent portion of the body bag, and they are advised not to open the body bag. The cremation is then carried out at the crematorium with all religious customs, keeping the number of relatives to the least possible as per the prevalent guidelines.